Greetings, my name is Mark Commons and I chair our Conference Board of Pension and Health Benefits and am a member of East Cross Church in Bartlesville. Today I would like to thank the dedicated people who have done thoughtful, outstanding work during the past year on both our pension plan and health plan changes for Oklahoma's clergy. We must be in compliance by 2014 with General Conference legislation and with federal law. Over the past several months, a number of key groups, this board and its subcommittees, a joint task force, our Council on Finance and Administration, conference staff, and more contributed much time, effort, and expertise to develop solid solutions for the Oklahoma Conference. Delegates, I ask for your careful consideration as we now present them to you. Next in this video, you will hear Dr. Bob Long explain these proposals. He is a member of our board as well as a member of the General Board of Pension and Health Benefits and the senior pastor at St. Luke's United Methodist Church.
It's so good to get to be with you today and to talk to you about two very important clergy benefits. We need to talk about pensions and we need to talk about health care. Some changes are coming at annual conference that we have to deal with. Whether we wanted to or not, we now have to deal with it. At our general conference, the delegates passed a revised CRISP program, our Clergy Retirement Security Program, better known as CRISP. There are some changes that have to be implemented. And because of what was passed by Congress back in 2010, we now have to make some changes to our health care program because of the Affordable Health Care Act. Again, these aren't options, these are things that we have to do. So let's look at the pension program first. The good news about our pension program is that we are very well funded, and all these changes have nothing to do with all the previous benefits. Whatever you're getting right now, it's well taken care of and you will continue to get them. The same thing is true about all the benefits you've earned up to this time. None of those will be affected. But what it does affect is all the benefits to be accrued starting in 2014. I can tell you right now that for those of you who are in your 50s and 60s, this change is not going to mean a whole lot to you. To those of you who are in your 30s and your 20s, it's going to mean a whole lot. It's very important you understand what is now happening. Part of the change had to come about because as United Methodist Church, we're all connected. And the General Board of Pensions sends a bill to each annual conference for all the pension liabilities. And what we found happening was there are conferences around this country that are finding it very difficult to meet those pension obligations. If those pension obligations are not met, then all the other conferences have to step in and make up the unfunded liability. What that really means is if there's some conference in the Northeast or the West that couldn't make their payments, theoretically it could come back to Oklahoma. We would have to help make those up. That's why the General Board sat down and tried to come up with a plan that everyone across the country should be able to afford. So what's happened now with our new plan is there's going to be a reduction in benefits for the pastors. That means there's going to be a savings to the churches and a reduced liability to the annual conferences. And in the long run, we believe this can be a good thing as it hopefully make our churches strong so we can be about the business of making disciples for Jesus Christ, for the transformation of the world. But those changes have had to be implemented. Let's kind of walk through a few of the things. First of all, for all of our laity out there, we have so many acronyms. Let me tell you about them. CRISP, it is our Clergy Retirement Security Program. There's two parts to that program. First, there's defined benefit. Now, a defined benefit means there is an amount that a person is going to receive monthly for the rest of their life after they retire. If you worked for GM, if you were a teacher, you probably have a defined benefit program where you know you're going to receive a monthly amount when you retire for the rest of your life. That's a part of CRISP. But we're kind of a hybrid program. We also have defined contribution. Defined contribution would be like you worked for a large company, maybe like an IBM, and they gave you a specific amount to put into a 401k. And that number bills, it goes up with the market, down with the market, but in the end when you retire, that's your money to do with whatever you want. And you can spend it all and have nothing, or you can try to make it last the rest of your lifetime. So under CRISP, we have defined benefit and a defined contribution part. Then we have what's called UMPIP, United Methodist Personal Investment Program. And that's kind of like also a 401k. If you were a farmer and there was no one putting money away for you, you took money that you were able to put away and defer taxes on and let it build till you retired, then you take the money. That's kind of our UMPIP. We're able to put money in tax-free until we are going to retire. And clergy are encouraged to be able to save, to invest for the future in retirement. However, churches can also put money in the UMPIP if it is set up according to certain kinds of rules. We're going to talk about that today. And lastly, you need to understand a term called the Denominational Average Compensation, DAC. What that basically is all the salaries that pastors make across the United States are all added up, divided by the number of pastors, and we say that's the average salary. That's the Denominational Average Compensation. You're going to hear us using that term in several different formulas throughout the day. All right, let's look at some of the changes. First of all, in the past, all clergy appointed were under the CRISP program. Starting in next year, only full-time appointed clergy will be under the CRISP program. People who are half-time, quarter-time, three-quarter time, they're going to wind up being covered under a different program. And what that will be is 10% of their billable compensation will be billed to the church, and that will then be put into their UMPIP account, just like their 401k, so that all clergy are still earning benefits, but our part-time clergy will be under the UMPIP with a specific defined amount that is being sent, 10% of whatever their billable compensation is. For full-time clergy that are appointed, they will still be under CRISP. So the second big issue is we changed the defined benefit. What the defined benefit used to be was 1.25% times the DAC, that denominational average compensation, the average salary, times the number of years you served. And that would come up with a number that you would then receive monthly for the rest of your life. We now have lowered that to 1%, percent times the DAC times the number of years you serve. As you can see right off the bat, that's basically about a 20% reduction in the benefits to the clergy. That is significant. What that means is clergy need to save more than ever before. So let's look at the third issue, which is the defined contribution. In the past, churches were billed for 3% of the billable compensation. They're still going to be billed 3% for that billable compensation. But the agreement is that a pastor gets 2%, but then they get 1% more if they contribute 1% to this UMPIP program. If the pastor does not want to give that 1%, then they only get 2%. 2% will be given by the churches, but not the 3%. To get the 3%, you got to give 1%, which would actually make 4% that is going to be going into their retirement account. Now, every pastor needs to understand you're in charge of your money and whether you choose to save it or not. Churches, when you get your compensation forms for charge conference, it's already going to be on there that whatever that salary has been set, that 1% needs to be set aside for retirement. If a pastor does not want that to happen, they can elect and stop that. But then they only get 2% as their credit, not 3%. If they want to put in the 1%, they'll get 3% credit. And if they want to put in more, they can put in more, which is what we strongly encourage. You just saw you're about to have a 20% reduction in your defined benefit. So it was all supposed to try to encourage clergy to save, because when we looked around the country, what we saw was that the majority of clergy were not taking savings seriously to help them be prepared for retirement. So the defined contribution will be 3%, but to get that 3%, clergy, you got to give 1%, and we hope you'll think about doing even more. So the issue is, how does it now get billed? What we wanted to do was to make the billing as equitable as we possibly could. We will receive that bill from our general board. And so the idea is that every church that has a full-time clergy under appointment will start with a base of $3,000. $3,000 is what it's going to be per year, plus 4% of whatever the billable compensation is, up to 1.5% of that DAC. Let me explain that. Let's say that you're a church and you pay your salary $50,000. Your bill would then be $3,000 plus 4% of the $50,000. That's what the pension responsibility would be, plus the 3% for the defined contribution. If, on the other hand, you paid $75,000, you would wind up paying $3,000 plus 4% of the $75,000 and the 3% for the DC. If you're a pastor, you paid your pastor $125,000, then you would be responsible for $3,000 plus 4% of 1.5% of the DAC, which right now would be a number around $100,000. You would pay 4% up to the $100,000, and that would then be all, plus the 3% for the defined contribution. That's the way that the billing would actually work. What all this really means is, for our smallest churches, for those with part-time people, they're going to have a good savings. For most churches, there will be a reduction in cost. For the annual conference, there will be less liability for all the future payments of our defined benefits. And it all comes, though, at the expense of having to reduce the benefits that are being paid to the pastors. And so we want to encourage the pastor to do what they can to be able to save. That's pensions. We have to deal with it. So let's move on to health care. Back in 2010, our Congress passed the Patient Protection Affordable Health Care Act. And that is changing everything. This is one of those kinds of things. There are so many laws, so many regulations, so many rules that we now have to meet. It is incredibly complicated. Far more detail than I can possibly go into and cover in this video. That's why when this gets all over, we're going to wind up having conference staff who are going to be there to help answer questions for you, because it is a very complicated thing, but we want to try to make it understandable for what we're needing to do to be able to meet the new laws of our federal government. You need to understand that our program right now for health care is really a self-funded, self-insured program. What that basically means is we're not with some major insurance company. We collect all the money that we need to provide the health care of our participants. The issue is, if we use health care, we spend $1. That means $1's got to come in. $1 in and $1's going to go out. If we don't spend the health care, we don't have to raise the $1. So the issue is, how do we cover the health care of our participants? The way we've been doing that is through an apportionment. We have an apportionment right now for almost $5 million that the churches give to help cover the health care for our retirees and for our active participants. Then, if you look at that, the part of that, about half of that apportionment, covers actives, half covers retirees, and in order to still cover the rest of the expenses, it comes through premiums that all the pastors pay. We pay that, that comes together along with that apportionment, and that covers the cost of what our health care actually costs, the annual conference. What we're suggesting is that we now do something totally different because of this Health Care Act. We have to do something different to stay in compliance. We want to take our apportionment and cut it basically in half. We can have that apportionment to cover our retirees. And so you'd be saying about $2.5 million set aside for the retirees and to cover their health care, but of course they have Medicare and all those other good things. But then you have the other part of that apportionment, another $2.5 million, and we want that apportionment to go away. What we're going to need to do is stop billing through apportionment, and we're going to go to direct bill to the churches. What we will do is, in 2014, we would like to suggest that we reduce this apportionment by 25%. $2.5 million will go down 25%. And then at the same time, we need to ask the churches to pay $135 a month to start supplementing the health care. And then the next year, we'll reduce that apportionment another 25%. and the amount at the church will go up another $135 to $270. And then the third year, we'll reduce it another 25%. It'll go up another $135. The fourth year, the apportionment goes away to zero, and now the church will be spending about $540 a month for the health care for the active clergy. Of course, there's always going to be inflation or whatever the additional cost is because we are a self-funded plan. But that's basically what would happen, and so that apportionment would go away, and now it would actually be the cost going directly to the church for the full-time clergy that they have. If you look at it, we now have to go to a slide that's going to look at all of our cost, the premiums that all the pastors are going to be paying. Again, this is now something that is very much having to get in line with the federal program. That's what's dictating some of these premiums and the way we can set them up. The premium that you're now going to be paying as clergy is going to be 9.5% of our minimum compensation. That's a compensation number that is set that all clergy in Oklahoma will make at least this much. That's established by our Equitable Compensation Committee. So 9.5% of that will be our premium for those who are in active service. You'll notice that's $248 a month in 2014. That's a significant reduction from what that used to be. That is because of the Federal Health Care Act to get us into alignment with it. But then if you look at the premium that's going to wind up being for clergy plus one, that's maybe a spouse, that's maybe a child, you'll notice that that premium is actually just about the same number as we're being charged right now. And then you'll see that for those who are having a whole family, that is still a higher number, but it's the same number basically that we're being charged right now. That will get us into compliance with this Affordable Health Care Act if we start having those premiums and we're billing it in this kind of a way. Now, of course, our part-time clergy are not covered by that, and so for small churches, what that means is that this apportionment is going to be going away more and more and more each year, and that is going to be a real benefit for our smaller churches. What it means is that for all of our churches, we will have a better feel for what is the real cost of this benefit for having a full-time clergy there at the church being able to serve. If there's a multiple appointment, well, that money will be divided between each of them on a pro rata basis. That will be easy for us to handle. One other thing that we really think is important is that all the people who are in extension ministry, they need to begin writing into their budget their coverage for health care cost. They do not pay apportionments in extension ministry places, so there is no apportionment to be going away. But what you'll need to simply be doing is in 2014, you need to add in $135 a month to your budget. And then the next year you need to add in another $135 and do that for 4 years. We're spending 4 years doing this so that everybody has plenty of time to plan and there is no great shock and change, and everybody should be able to do this. As I said in the beginning, we happen to be a self-insured program. That means if we don't spend the dollar, we don't have to raise the dollar. If we spend the dollar out, dollar's got to come in. That's the bottom line. So we're also going to propose an exciting thing. We're going to start working very hard to give clergy an incentive to be healthy. What we're proposing in 2014 is that there are 6 items by which a clergy can begin to earn a deduction in their premium of $10 for each of 6 items. Let me explain what I mean. Every year, as you know, when we come to annual conference, we have our wonderful health screening. It's free. It means you got to take the time to fast and come by and draw your blood. That's all you got to do. It doesn't take a long time, but boy, do you ever learn a lot about your health. If you will take the time to come to annual conference, go to that free health screening, we will give you a $10 deduction on your monthly premium all year long. That's pretty good. Secondly, we'll give you $10 if you refrain from using tobacco. Now, we know there are many people who enjoy tobacco, and that is their right. But we also know it is bad for our health. If you refrain from using tobacco, we'll give you another $10 a month reduction on your premium. And then we have 4 items. You can see them there on the chart. With these 4 items, they're important indicators about how we're doing on our health. What is your cholesterol level? What is your blood sugar? What is your blood pressure? And what is your density? That means our fat. How are we doing? You look at all 4 of those items, you make a line, you meet these goals, we'll give you $10 for every single one of them that you meet. That means up to $60. $60 a month. That's $720 a year. For most of us, that'll cover the 1% we need to be sticking into our UMPIP to get the extra percent. It can be a great deal, or stick it all in there and start your savings. We believe if we as clergy take seriously our health, we feel that we can help to lower the amount of money that's having to be asked out of the churches, as well as our own premiums. And so we're willing to offer you these incentives, and we think there's some good things. I know these are a lot of changes. They are things that we have to deal with. We cannot help it. This is what General Conference said, and this is what our Congress has said. And so we're going to try to do it in a very positive and creative way. We believe that by doing this, it should help maintain benefits for the clergy, reduce some cost to churches, and hopefully make us strong, so that together, you and I can take seriously making disciples for Jesus Christ for the transformation of the world. Thanks for listening, and have a great day.